Today, I want to talk about mental health, particularly mental health in America. There's so much stigma today around mental health. There's so many myths that aren't debunked. There is barely any media coverage on mental health, and how often do you see chronic illnesses like cancer, like diabetes, for example, injuries, anything like that broadcasted, but yet something that we are very, very much aware of at this point. There is a mental health issue. It's completely ignored to an extent. It just doesn't make that much sense to me, particularly from where I'm coming from. But we'll get to that later. I want to discuss how common it is amongst our population. I want to discuss why we have these stigmas, why the myths aren't busted, why we continue to support these myths, why nobody steps up when they hear, oh, you have OCD, does that mean you wash your hands a lot? Nobody steps up to the plate when it comes to these things. It's just something that we're so in tune to hearing now in today's society that nobody really thinks anything of it. That's just the stigma that is around mental health today. And I think it needs to be acknowledged that this is a problem. This is a problem, especially in American culture, considering everything that's happening today, considering one of the most prevalent topics in the media is gun control and what we can do about it. But look at who are the people that are killing all of these people, who are the people that are committing these mass attacks are typically people with mental health disorders or some sort of history of it or some sort of family history. So why is something that's so media broadcasted, has so much attention on it, why is it not getting the attention that it needs? More importantly, why are the people, the thousands, millions of people that suffer from this still hiding behind the stigma that is mental health disorders and that we have on them in America? Anxiety disorders alone affect 5% of adolescents, of children, essentially. Children affected by anxiety disorders. What do they have to be anxious about? This just shows that it's not something that is just there. It's something that we have to acknowledge. It's something that is a problem. That comes from the Journal of Pediatrics and Child Health, and it's an important factor to acknowledge because of how impressionable, how delicate the child's mind is, and to be going through something like anxiety, like a mental health disorder at that age is hard. We need to make the population more aware that anxiety, that mental health issues, that things like OCD, ADHD, these things, depression, any of it is our reality today. And it needs to be acknowledged. It needs to be taken care of. We need to not feel horrible, or the people who suffer from these things need to not feel horrible for something that they can't control. And our society needs to be aware of that. I just do not understand why a child needs to be embarrassed about having something that they cannot control. There's too many myths that they say you can make these things stop. I've heard that from the time that I was a child. You can make these things stop. You have control of these things. People don't think of mental health disorders the way that they think of chronic illnesses, the way that they think of even an injury, even busting your knee. There is a cure for that. You put some Neosporin on it, you put a Band-Aid on it, it will get better. But people think, oh, snap out of it, get out of your head. It doesn't work like that. And it's time that people see that it doesn't work like that, that there are ways to cure it, and it's not just a mindset. So now that we've established both the problem and what we need to do to change it, at least in my opinion, I want to tell my own story. When I was about 6 years old, I started having really, really bad anxiety. And at the time, I didn't know that it was anxiety. I just thought that kids worried. I just knew I was constantly stressed out, and I didn't have anything to be stressed out about. I was a kid, but that was my normal. And like I said, for a child to say, "Oh, that's their normal," that's sad and it needs to be acknowledged. So things progressively got worse whenever I grew up. At about 9, I knew something was wrong because of how much my life had been impacted by this anxiety, and what I later would find out is OCD. And it's something that I suffered from. And a lot of people are, this is where the stigma comes in, where the myths come in, are unaware of what OCD is. That's one of probably the most commonly referred to disorders, taken completely out of context, is obsessive compulsive disorder. So I just want to take a minute to define it based on the American Medical Association. Obsessions are unwanted, recurrent thoughts, impulses, or images that are experienced as intrusive or inappropriate. And compulsions are repetitive behaviors or rituals that the person feels driven to perform in a particular way. So my interpretation of this, based on experiencing it, is that we do compulsions in an obsessive manner to get rid of the anxiety that comes from the recurrent thoughts or the obsessions. And it becomes a pattern. This is not, "Oh, that's gross, I need to wash my hands every 20 seconds. Of course it can be, but that's what the media, that's what society has turned this disease into, and it's not that. From my own personal experience, like, I will get emotional probably about this because it's something that I've dealt with my entire life. But when I was 9, every single time I went to the bathroom, I would have to sit there and count. And everyone always says, "Count? What do you mean? What would you count?" And I don't even know what I was counting. But these are patterns that were relieving the anxiety that I felt, because for some reason I felt like something bad was going to happen to me every time I went to the bathroom, which clearly isn't a normal thought process, but that was my normal. So I would count, and every time I messed up, that added to what I had to count. That added to the patterns that went along in my head. And so eventually, every time I went to the bathroom, I was sitting in the bathroom for 2 hours trying to count these things, sobbing, because obviously not every kid goes to the bathroom for 2 hours every time. That's not normal. But that was my normal. And I was suffering. Every single time I changed the channel on the TV, I would have to reread the summary of whatever show was on, like 14 times or whatever. I remember I couldn't touch certain things with anything besides my right hand. And if I did, I would immediately have to wash my left hand. I couldn't sleep on certain sides of the bed. If anyone touched me in like certain sides of my body, I would freak out and have to like repeat those touches on the other side. This is the reality, and this took over my life. And again, I was 9. Like, imagine a 9-year-old going through that kind of thing. At the same point in time, I already mentioned I had anxiety. I was worried constantly about things that I didn't know about, and I knew that this wasn't normal. I knew that this, at one point, I did think this was normal because I was an impressionable 6 through 9-year-old and this was my normal, but it got to the point where, like I said, not every kid, not every person is sitting in the bathroom for 2 hours counting, and I knew that. I knew that I had no reason to be doing this, but I felt like I had to, and it was increasing so much anxiety inside of me. So eventually, I broke down and told my parents. And this is something that you don't see. This is something that my psychiatrist that I saw that I still see to this day was like, this just shows that you have very good parents. They told my parents, just shows how much she trusts you guys, because this doesn't happen. According to the Journal of Pediatrics and Child Health, young people in anxiety disorders are among the least likely to seek appropriate help. Pediatricians are in a unique position to identify anxious young people and educate families and recommend that intervention. Pediatricians, I went to my parents and I told them, broke down, vividly remember this day, I need help because I'm not normal. I told them everything, and then I went to the doctor and I got help. I got cognitive therapy once a week, which was petrifying for a kid. I talked about what was wrong with me and my therapist helped me through it. I got put on Zoloft, which made me in turn suicidal at 9, which my parents were like, oh my gosh, this is the worst thing ever. It made all of my symptoms so much worse. And this was my reality. This is the reality of so many people in today's society. This is the reality of 5% of children in America. And I didn't know what to do. So we went back to the psychiatrist. We said, this is not working. They put me on Risperdal, and the 20 milligrams of Risperdal that they put me on changed my life. I literally don't know where I would be without that. I don't know where I would be without that intervention. I don't want to know. Eventually that turned into me being on Risperdal and Prozac because my anxiety was still so bad and I needed the help. They eventually weaned me off Risperdal, and then as I got older, my OCD symptoms diminished because I got through it, but not because I just made it go away, because I worked to get rid of it, to be stronger than the disorder, and that's what my therapist always told me. So with all that being said, it doesn't just go away. And I developed panic disorder after that, where I was having, for some reason, panic attacks. And if you've never had a panic attack, it basically feels like you're going to die. Your chest clenches up, you can't breathe, your vision goes black, you literally start taking the most shallow breaths, all your muscles cramp up, and it is the scariest feeling ever. And you just feel like you can't breathe. You feel like whatever is causing the anxiety in that impending moment is going to kill you. I started having those on a weekly basis, which again wasn't normal. And just for reference, the Anxiety and Depression Association of America defines panic disorder as it is diagnosed in people who experience spontaneous, seemingly out of the blue panic attacks and are very preoccupied with the fear of a recurring attack, obviously, because you feel like you're going to die. Panic attacks occur unexpectedly, sometimes even when waking from sleep. Panic disorder usually begins in adulthood. It began at age 12 for me. But children can also have panic disorder, and many children experience panic-like symptoms. So again, this was my reality. Had my parents not been the parents that they were, I wouldn't have known what to do, because society is not set up to where I knew where to go for this. I didn't see my pediatrician. I was on a regular basis. I saw once a year for my yearly checkup because I was a fairly healthy child. And so who else am I supposed to tell, especially once I did feel comfortable talking about these things? And the responses that I got consisted of, oh, you have OCD, you're one of those hand washers, or why do you take so long taking tests? Even whenever I hadn't come out, my teachers treated me differently. You're segregated in schools. As soon as I was diagnosed with this, I obtained a 504 plan and was put into different rooms to test, which, I mean, obviously that helped with my testing in middle school, but it made me feel different. And I knew I was different at this point, but why are we setting up our society like this? Why is there still, like I mentioned before, this stigma around it? So, all in all, I think from just telling my story, and obviously, like, this comes from somewhere very, very deep in my heart because it's something that I have personally experienced, but it's something that I've also witnessed. I know so many people to this day that have a mental health disorder, and it's not a bad thing at this point because it's so common and it's something that needs to be accepted as common so that we can treat it correctly. Think about how much better our society would be if every kid opened up to their parents and got the help they needed right away before it turned into something horrible. That every kid opened up to their parents and their parents made the right decision. That every single person who had a mental health disorder got the right treatment and got better. Because, I mean, clearly I'm better now. I still have my reoccurring panic attacks. I still have anxieties, but it's not to the extent that it was. It's not debilitating. I'm a functioning, successful adult, and I can contribute that to my doctors and to my parents, but not to the way that society is set up. And I want to change that. I want it to be made aware that this is a problem, that this is a huge amount of our population that is affected by it, and our impressionable population, specifically in children. And it needs to be made aware. And maybe things in society will end up getting better if we actually acknowledge what some of our problems are. Thank you.